Hey everyone, and welcome back to our channel KiDENTAL. For all of you dental students and enthusiasts, today we are discussing a crucial clinical topic. Its ultimate goal is to preserve the natural dentition. Sometimes, due to the extensive carious lesion, the pulp of primary tooth becomes irreversibly damaged. That's where the pulpectomy procedure comes into picture. So, let's break it down, starting with the basic. Pulpectomy, in simple term, it's a complete removal or extirpation of vital or necrotic coronal and radicular pulp tissue from the root canal of a primary tooth. Think of it as the primary tooth's version of a root canal treatment in permanent tooth. Pulpectomy in a primary tooth aims to eliminate infections, relieve pain, and importantly, retain the tooth until its natural exfoliation time. This is crucial for maintaining the arch length, guiding the eruption of the permanent successor, and ensuring the proper mastication and speech. Now, let's discuss all the indications for performing a pulpectomy in a primary tooth. We consider this procedure when a tooth has got a deep cavitated lesion that may or may not be associated with intraoral draining abscess and may or may not have intraoral or extraoral swelling that might be associated with the history of nocturnal pain, whereas on radiograph one can appreciate an ill-defined radiolucency involving enamel, dentine, and pulp tissue, which causes PDL widening and discontinuous lamina dura, along with radiolucency involving the furcation area. And finally, the tooth that does not show any signs of reversible pulpitis can be one of the indication. One more consideration can be tooth which has got root length more than 2/3. Of course, not every primary tooth with a pulp involvement is a candidate for pulpectomy. There are certain contraindications we need to be aware of. Caries that are restricted only to the enamel and dentine. Secondly, where there is excessive root resorption. Third, insufficient remaining tooth structure to allow for the proper restoration after pulp therapy. Another consideration could be medical systemic condition that is contraindicating the endodontic procedure in that patient. Pulpectomy is not done in the cases where primary tooth is very close to its natural exfoliation time. Extraction may be more practical option in that cases. Hence, a careful clinical and radiographic evaluation is a crucial part in identifying these contraindications. Alright, now let's get into the heart of the matter, the steps or the procedures that are involved in performing the pulpectomy in a primary tooth. Diagnosis and treatment planning involves a thorough clinical examination, including assessing the extent of the carious lesion, the presence of pain or swelling. Radiographic evaluation is essential to determine the furcation status, root morphology, and the stage of root resorption. Based on this assessment, a treatment plan is formulated. Achieving adequate local anesthesia is a paramount for a comfort and successful procedure. Rubber dam isolation is mandatory to maintain a sterile working field and prevent aspiration. Access cavity preparation is carried out using sterile round burr and safe end burr. An access cavity is prepared to gain a straight line access to all the root canals. The outline form will vary depending on the tooth being treated. Once access is achieved, the coronal pulp tissue is carefully extirpated using barbed broach. An accurate determination of working length is crucial. This can be achieved using a combination of tactile sensations, radiographic method like Engel's technique, and apex locating. The working length should typically be 1 to 2 mm short of its radiographic apex to prevent over-instrumentation. This step involves the mechanical cleaning and shaping of the root canals using flexible endodontic files. Due to the often irregular and ribbon-shaped canals of primary molar, circumferential filing is preferred technique. Copious irrigation with biocompatible irrigants like normal saline or a diluted sodium hypochlorite is essential to remove the debris from the infected canals. Remember to use a gentle irrigation. Obturation is a crucial step in pulpectomy. The ideal obturating material for the primary tooth should resorb at a rate similar to the physiological root resorption of a primary tooth. The commonly used material include zinc oxide eugenol, Metapex, Vitapex, Endoflast, KRI paste, and many more. These materials are carefully introduced into the canal, ensuring the complete obturation without overextension, followed by a well coronal sealed restoration and a crown. Remember, mastering this procedure is a key skill. We hope you found this comprehensive guide to pulpectomy in primary tooth valuable. Let us know in the comments below if you have any queries or specific aspect you would like us to elaborate. Stay tuned until next video where we'll learn each step of pulpectomy in detail.